Well, hello everyone. I'm glad you could join us tonight. And we have a recording tonight of an earlier interview. It was done by Paul Herrington, one of our staff. He was able to interview Dr. Paula Emily. Yeah, I think you're going to find this fascinating, this interview. So we're going to get started with that in a minute or two. But I just wanted to point out a couple things. First of all, for all those that are joining us tonight, your ballot is being entered in for winning of a Palm Ultimate, a $1,300 device that allows you to treat with 660 nanometer and also 810 nanometer with a significant amount of optical power. And this is a beautiful machine. You can also, because we run it not off a battery like lithium batteries, that sometimes can be problems for airlines and that. This runs off of a power pack, like a power adapter. That means you can run this 24/7 and never have an issue with batteries to replace or anything. And there's so much energy that we're using. The other thing is we need a great big battery pack on the back of that. So it wouldn't make it very convenient, easy to use. So that's why we decided to go with the power adapter. And that power adapter can work anywhere in the world with the voltages. You just need one of those little mechanical pin things that convert the pin size, whether it's the round pins to the flat blades, or whether it's the three prongs, heavy prongs, and then to the flat plate, depending on which country you're going to. But most countries have those little adapters to be able to switch the connector over. So it's not a problem to take one of this type of an adapter and just plug it into that. And then this can run off at 240 volts as well, no problem. The full range of voltage. So that's our device. And what we're going to do right now is we're going to get into Tom Talk 1. Go. And it's tell you a little more about our products. And then we're going to get into the interview in just a minute. PBM stands for Photobiomodulation. Photo being light, bio being biology, and light, well, light coming from some kind of source. In this case, PBM is used to help stimulate healing in the body, whether it's an LED, whether it's a laser, whether it's the sun, but that light comes through the skin layers, and actually the cells are able to absorb that light, converting it to energy, and then there's a host of different processes that are stimulated because of that light. So you can speed up healing, you can do different things that is very beneficial for the cells themselves, for healing, for reduction of inflammation, and a host of other things. Kerber USA is a company that we have set up to promote healing for the US and around the world. We would like to see this technology help a lot of people. We use LED technology where we can provide high amounts of light into the body, and that stimulates healing. I'd like to introduce you to the SunPowerLED Palm Ultimate. This device here has the most power of the series of devices. This light can produce a huge amount of light that can enter into the body and help speed up that healing. In this device, we have two different wavelengths. It's 660 nanometer, and as you can see, it's very bright, but it's very effective. You will cause a systemic effect with this wavelength of light. The other wavelength is 810. It's not very visible, but it penetrates very deep, and that can help as well reach the target that you're trying to reach. The main part about this light is that we have the power behind it and the large surface area that can reach very deep into the body. We believe that our product is the most powerful LED cluster under the sun. We have specification of this device of 150 milliwatts per square centimeter. And that is over this entire area of 40 square centimeters. It also provides a wall of light that comes through the skin and is able to reach depths that have never been able to be done before with other light products on the market. There's an interesting biblical passage in Malachi 4:2 that talks about the healing that comes from the rays of the sun. And that's what we're trying to do. We're trying to provide healing with these rays. PBM has also been shown in various studies to be able to help promote healing in wounds such as diabetic ulcers, venous ulcers, and other areas where cuts or burns or other types of wounds are on the skin level. If you have any questions about PBM and how our light device, the SunPowerLED Palm series, can help you, please reach out to us and we'll get back to you as soon as we can. So just a little update to that video. We created that a while ago, but we do have a more powerful, in a way, similar power, but in a way, because of the new wavelength of 1050 nanometer, we're able to penetrate a bit deeper. So it's kind of like having a little bit more power. But regardless, we have the Super Palm 1050. So that's an update to that video. As well, another update is that we have a new clinic. If you're in Ontario, Canada, and you're near Toronto, there is a new clinic in Toronto, and it's called Light Therapy SunPower. Contact Merton, and you'll be able to try out the technology in the Toronto area. The phone number is 416. We'll put it in the chat line as well. The phone number is 416-321-7777. So we thank you for other clinics out there. We're going to create a map where all the clinics are that are using our technology now. We're very thankful to all those clinics, but this is a brand new one that just popped up. And if you're in Ontario and in the Toronto area, please visit Merton there. So it's the interview tonight will be with Dr. Paula Elmi, and she's a DMD, and I think you're going to find it most interesting. The interview was done by Paul Herrington, who's one of our staff, and he will be doing the interview. This time around, I couldn't coordinate the times to work to try and do this interview, so I thought, hey, Paul, why don't you please go for it?
Hi, Dr. Elmi. How are you today?
Very good. Hi, Paul. Nice to be meeting with you today.
Yeah, excited to talk with you. Thanks for joining me. For anyone tuning in, my name's Paul Herrington. I work closely with Tom Kerber at SunPowerLED and the team over there. Dr. Paula Elmi is here. She's graciously joined us to share her experience with SunPowerLED and our technology. Now, Dr. Elmi, red light therapy and photobiomodulation is a hot topic, and as a medical professional, your perspective carries weight, and I know your time is extremely valuable. So really, again, appreciate you taking the time to share some insights with us today. People all over the world are racing to understand the science and the benefits to this new but old technology and therapy, so we're eager to have you share with us. So how does it sound if I ask you some questions, save a few tough questions for a little later, and give you some lob balls to start?
Sounds great.
Okay. All right, great. So to start things off, it sounds like, just talking to you a little bit, that you don't leave home without your SunPowerLED device. Is that true?
I usually like to have it with me close by, for sure.
Okay. Great. Sorry, couldn't resist that as a question to start. So to kick us off. All right. Can you tell us just a little bit about your background, your medical background, your area of specialization, and how long you've been practicing for?
Absolutely. So I'm an endodontist, so that's a root canal specialist, dental specialist. I've been practicing for, I don't want to think about this, over 20 years now. Uh,
Hmm.
and I was basically first introduced to photobiomodulation like really deeply back in 2021, while I was getting a certification for just basically surgical laser certification. And I was telling you a little bit before, at that time, there's a hands-on component usually where you'd go and fly in and work with surgical lasers, but that was not an option because basically all hands-on courses were offline. So everything went online. And photobiomodulation, they could do a hands-on course and tell you what to do online and go along with it. And I was just thinking this was I have to take this to get my certification. I didn't really know much about it or the powers of it. And I wasn't even planning to buy any standalone PBM devices, just thinking I could use my device, surgical device, for what they were talking about. But by the end of that course, I purchased two different devices. Uh, and really what I think the biggest thing that sold me on it was talking about people who had uh, oral lesions after chemotherapy, non-healing, sloughing oral ulcerations in the mouth, and that's something that we deal with sometimes in the dental field, and it's awful, and people who deal with that kind of thing, it's completely debilitating, and there are some medications that you can give and lidocaine rinses, but it's not really reparative a lot of the time, so people are really painful, and one of the instructors was talking about how his wife had gone through chemotherapy and used the photobiomodulation and did not got minimal, if any, of these oral lesions just by doing the photobiomodulation. So at that point, I'm like, well, there's definitely something to this. So I'm interested in using it. Now, I don't get a lot of that in my practice where I'm dealing with patients like that, but things that I do deal with in my practice, there's definitely oral ulcerations that we deal with, and as a root canal specialist, people will come in with pain, and sometimes they think it's tooth pain, but it's actually muscle pain. And by having these devices, just with one treatment, I can get people back to feeling a whole lot better just with one treatment. And I have some patients who
No
actually call
surgery?
no surgery, and with
Oh, great.
so and basically TMD, which is a lot of people call it TMJ, which is our joint, but a lot of the disorder of the temporomandibular disorder has to do with musculature, and so and trigger points in there, and
Hmm.
oftentimes by doing one session you can get people their muscles relaxing and getting more range of motion and just feeling better just off of one session. So something going in debilitating, and it gives people, it's nice to be able to give people hope right away that something can change.
Right. What a spark. And you can see them light up right on the spot, I'm
Absolutely.
sure. Yeah.
Absolutely. Yeah.
Great. So curious then, sounds like you had a couple devices. How did you first hear about SunPower LED, or how'd you get connected with Tom and the team?
So it was actually during that it was an 8-hour course, and Tom was he was one of the guest spots that came in to talk about his device. And I was really interested. Number one, I do appreciate smaller companies, and he was just very vibrant and real about his experiences with the light and the healing of the light. So and he was just really kind, and I was able to, I didn't want to purchase anything that day because I was like, I'm here just to learn. But there was like, if you purchase today, but we talked a few times afterwards, and we had some good conversations. He turned me on to some really good educational resources, and I decided I wanted to jump in and buy that, start out with one of those palm devices. I also have an intraoral only device that I use that is not from Sun LED, which makes a lot of sense for what I use as well. But I did want a bigger device that was basically going to be able to use like for the extra oral stuff that we deal with, especially the muscle and and things like that. And then I use it at home. We've talked about that a little bit at home. That device ended up
Sure.
being my holy grail device that I use it in the office, but I also have one at home as well.
Yeah, tell us about your personal experience with it and what you use it for, or if there's different injuries or pain relief that you use it for. Love to hear about that. It sounds exciting.
Absolutely. I'd say for me, it was interesting. I want to say within the first month or two of actually owning the device, I have a sciatic injury that flares up once in a while. And it's one of these things that I've been dealing with this for over 20 years. And I know when it starts coming on, I will I know I can feel the little symptoms coming on where it starts tightening up, and I know for a few weeks I'm going to be uncomfortable. It's not debilitating where I can't do what I need to do, but it's uncomfortable, and it's not it's not fun. But I had the Palm device and I had it at home, so I thought, oh, let me just put it in the area where I know the area starts flaring up. So I put the device on, just turned it on, tucked it into an area, and then I just started reading, and I got into whatever I was reading, and I realized 20 minutes later I wasn't feeling any pain anymore. And I
Oh,
thought, this is different. This is something new. So I turned it off and I started walking around, and it was like, wow. So immediately I went to my better half and I said, Eric, I'm not having I was starting to get a flare and I feel fine right now. And he's really, I'm like, absolutely, this is interesting. So we also like, let's pay attention to how things go the next few days, see if it, maybe you're just feeling good right now. But no, it never turned up into a full flare that time. So it that to me was one of there's definitively something here. I love catching, when you catch something early, you can prevent a full blown flare from happening.
and so did you see a need to use the device on the sciatica after that at all for a few
I
days? Were you
usually
using it?
I didn't, and I didn't even actually go back to using it for that because I just didn't have any more pain. So that time, and sometimes it's not going to like vamp it out completely, but it it's one of these things that I'm like, I know I have this in my back pocket, so I know that it's not going to get worse. So and some subsequent times, because that time was really nice because I happened to be home when it was coming on. And I think catching it so early, it just never
Hmm.
became anything on that one. I've had sometimes it
Hmm.
starts up at work, and and then I'll get home and use it, and then I might use it a few times. So but it's not something that I'm having to use every day or now I'm that's another thing, because if you're glued to something, like I have to use this every day for however many times this one thing, it's almost it's like a medicine. I mean, better than having to put it, I'd rather do that than take a pill.
Right.
Absolutely. But it's
Sure.
nice that I'm not tied to that because I know, I can use that a few times and generally things will get a lot better.
Nice. Yeah. Well, I'm just jumping in. My wife has this, like she has sciatica. She had sciatica for a couple months, and so hers was. We didn't catch it till after, and she ended up using the one of our mini canopies, one of the panels that we have. To She was in excruciating pain for months, so she actually had to use the panel every day just to even get a little relief. But beautiful testimony to that story. The end is like she is full-fledged restored now. She can go out and exercise and run and do like
Yes.
daily things that she loves to do. And but yeah, if she does feel a little bit of a flare, she'll actually put the Palm device on there and utilize that to help keep the flare down or avoid having a full-blown uh,
Right.
episode again. So yeah,
Was that her first time that she ever had the sciatic at that
yeah,
time?
yeah. This
That
is
was
her
going to say, because
first
the
experience.
first one I had was years ago, and I wish I would have had a device back then. It was about 20 plus years ago. I was down for
Yeah.
over a week. So that's why these flares are, luckily it has never gone back to that initial one. So but it's so great. I wish I would have known about photobiomodulation back at that time. It would have been a game changer. It was a rough experience.
Yeah, well, we have four kids, so to have her down and out, it's tough. She does so much around with the kids in the house and just work and everything. So yeah, it's tough. So amazing to have this kind of technology to help with that. So
Absolutely.
exciting. Anything else that you can think of you use it for personally with family, friends, or any?
Absolutely. Yeah, and I was mentioning earlier, I've had some episodes of frozen shoulder adhesive capsulitis, and it was interesting because I didn't know that what I thought it was a tear, so I had avoided. I used the palm device on the shoulder because once in a while it would bother me.
Let's get that so we can
Oh yes,
show everybody. I
that's
have
it.
one
That's
here just
absolutely, it's
sitting
right
around,
there.
and I thought I'd pull this out. And so this is
Perfect.
the nice little beautiful handheld palm device that you would probably utilize on your
Absolutely.
shoulder.
I'd use it on the front, side, back, just depending. Mine is usually on the front and side. But so I had been using it for a while, but again, like I had mentioned, I hadn't had this shoulder. I had an injury back in high school athletics, and so it was always this shoulder tends to kind of flare up on me. So since I've had this device, I would use it on the shoulder, and it's nice because it's rough. I'm doing in there doing dentistry, and it I'm like, the shoulder's acting up again, and it's not fun to have to go through a day like that. But this is just a recurring injury. But it had gotten really bad about I think it was about a year and a half ago now, and I thought it's torn, it's done. I can't even move my arm anymore very well. I've lost range of motion, but I wasn't putting it through the movement as much. I was using the device, but not doing the motion. So it was helping with pain, but it wasn't at that point. I wasn't getting a lot of range of motion back, but that was partially because I was afraid of moving it. So once I got the MRI done and I knew there wasn't anything torn in there and I could run it through the ringer, I was doing the palm every day and then running it through the exercises. And I would say, a lot of what I was reading about frozen shoulder, it could take a long time. It could take a couple of years to get through the whole cycle and get your range of
Mm-hmm.
motion back. And I'd say within a few months, I was back 95%. And it was amazing that I could not believe. I'm like, wow, I can't believe what I'm doing. And again, I would go to my significant other, and he's just like, watch out. Don't, you're gonna hurt yourself. I'm like, no, I
Right.
can do it and I can move it. It's can you believe? I'm like, I was just like a week ago, I couldn't move the shoulder. I couldn't, I could barely get it up, and now I can get it, up over my head. I was not able to lift my arm, and it's got, I've got full, I don't I'm wearing a shirt, it's a little tight right now, but I have full
Sure.
motion on that arm now. I
Amazing.
mean, so
How
I
how
can
long
go,
ago
yeah.
was that?
That was I'm just trying to think. I got the MRI results back April 2024. So by summertime, I was back to pretty much full range.
Wow. And
But I
and
had not
to
been moving it for, I had been holding off on, I had just been so busy and trying to get the MRI done. I think I had been in a pretty stiff position. It was at least 4 or 5 months where I wasn't really moving that arm around. So I thought,
okay.
I was like, this is it. The shoulder's not, I'm not going to get this range back ever. You feel like even with therapy sometimes, and even with surgeons, like maybe you get the feeling of this is my new normal. I'm really
Mm.
not going to have full range back. So the fact that within the time I got that diagnosis and I knew I couldn't move it through, and I'm like, this palm, and palm is going to help me here. Actually, I call mine Big Red. It's just a
Big
funny
Red?
little, yeah, Big
We
Red.
have another guy who calls our helmet the happy helmet. We've because it's restored his like taken him out of depression and anxiety and just made him vibrant and full of life again. So he calls it the helmet the happy helmet. So
I love it.
we're we're accustomed to people giving the devices nicknames now. So
Yeah.
that's great. Big Red. I like it. Cool.
Yeah.
So now, have you any further like encounters with relapse or
Yeah,
recurring
so
event
if
with
it's
the?
feeling a little, absolutely. So this shoulder will do that, and so I make sure, I have to do my exercises, but also
Yeah.
I throw the light on there and just give it a go. With the shoulder, I'm more consistent with that than say like the sciatic, because that's something that just flares up occasionally, whereas this has been just a normal tightness that I've been dealing with for years. So I definitely, I mean, usually at least a few times a week, I'm just doing consistent uh touch up. I don't know what the word is,
Sure. Yeah, yeah.
yeah.
Yeah. So how long, what would you do typically to treat your shoulder? Like how long would you normally
I mean,
use the
generally,
device?
it's sometimes I'll set it up usually minimum 5 minutes, but sometimes I'll go 5, 10. Just I try to run it through the two wavelengths. So
Okay. You use the
sometimes it's a
both the
shorter time.
six.
Yeah. Usually, I'll do. I like to do both, and I know with something when I'm trying to go deeper, it just depends. Like if I'm doing something more skin like, because another thing, this is interesting. Um this is completely off from shoulder or deeper, but I burned my arm. I recently, it was for Easter holiday. I was cooking, and one of the first times I was having to do some of the cooking for it. My family usually does. So I had a 500 something degree oven. I was just being hasty. I did have oven mitts on, but I went beyond it, and I don't know if you can see this scar a little bit. It's not very dark now. So that right here,
No.
but I seared myself really, like I was like, oh no, this is going to be a mess. So I took the stuff out, immediately ran to the palm, because I have the palm set up in the family room, which is just adjacent to the kitchen. Put that on, the 660, just ran it for a few minutes. The thing never, it never sloughed off. it never ended up hurting. You could see the sear mark, and so it got
Wow.
dark because my skin tends to pigment quickly from injury and things like that. So I had a dark line, but it never blistered. And I was just, there's no way that should have happened. I mean, I know I've burned myself, toaster quite often. I'm known for that kind of thing.
Right.
And
Right.
so, again, I was just like, look at this. And everyone's like, stop touching it. It's a burn. You're going to cause a problem. I'm like, no, it never ended up turning besides this dark line. I know this is my little reminder, but I just have a little reminder on my arm that I can see, but no pain. I was astonished, really.
That's spectacular. Yeah. Lots of cases like that. A great thing is to get it as soon as possible, which you
That
did,
was,
and that's incredible. I've seen some like second and third degree burns and the recovery where there's almost no scar. Like you could see it down the road. Tom has some pictures from his granddaughter even. So like burned
yes.
her leg with a boiling pot of hot
That he
water.
had told me that story, or I'd heard either he told me or I think in one of our first conversations. So that's why that had like
Oh
get
yeah.
to the thing immediately to
Yeah.
get that on there.
Amazing. Yeah. It's
It's
miraculous.
absolutely. And just knowing that, yeah, knowing just having that, and like, again, having the magic in the back pocket is a good thing because it's for anything, just even little scrapes, scrapes, bruises, just helps with all types of healing. So
Great. Now, can can you share maybe for someone who's never used the device before, if you can remember back kind of like to the first time you turned it on, like what were some of the feelings or thoughts you had when you first turned the device on to use it? How did it feel? What did you think was, what were some effects that you saw from it?
Um, I feel like what most people say, oh, it's a nice warm feeling, like it's just a nice, it feels like the sun, it feels like you're just, eh, not that I lay out in the sun a lot, but I was laying out in the without sunscreen, unfortunately. That just nice feeling of the warmth going on. And I love, that device it's just, I'd say that's some of it. To me, it's calming too,
Mm, hmm.
it might
Okay.
just be the white noise hum of the of the fan. Um,
Sure.
and
I would say the same. Like often I'll use this even just
mhm,
on my head. I'll maybe use it on three or four spots on my head, and like it's almost an instant like
oh,
relax. There's a stress alleviated, and you just feel like you
mm,
could think clearer. And yeah, if I can, I'll use it every day on my head. So. Okay, maybe shift gears a little. Sounds like you've been using this on patients and in your practice. Can you share a little bit more about how you've been doing that and the effects that you've seen and maybe some of the benefits you've seen on patients as well?
absolutely. So in the practice, I would say and honestly, I am using a different, like an intraoral device that's made just for intraoral device. I'm using that every day, and so that's where the
Hmm.
the big red name came to be because we have the other one is named something else, and that one is Grab Big Red. So if someone comes in, so as a endodontist, my treatments or root canal, treatments are a longer period of time. Generally, someone's going to be, if we are doing treatment, they're usually in the chair for over an hour. And some people who have like a small range of motion, luckily I do have smaller hands, but still it's hard for someone to stay open. We use a little resting block to stay open. But if someone is not able to open wide, sometimes people will come in and they're like, I can't open really wide. And so one of the first things I'll do is just see, is this muscle, or is it, can I get them to open a little wider with me helping? And if I know there's a little bit of play there, before we even do anything, I'll just set them up for usually like 5 minutes on each side. And just within that time, we usually can get at least another 5 millimeters, which doesn't sound like a lot, but that's a lot, maybe even more, maybe even a whole centimeter wider. And that just releases the amount of release in stress and loosening those muscles. To me, that is, it's so quick, and just the relief of the person. So that's one of the big things that I'm using that for. And the other thing
Hmm.
that I was mentioning to you is that when someone comes in, and they're having pain that they know that it's some of the things that trigger me to think is this muscle pain versus actually tooth pain. Um, I had a patient one time. I wish I had the PBM device back then. They said they started getting tooth pain after a day of smiling for a photo shoot. And I'm like,
Huh.
that's interesting. I'm like, this might be more muscle because you're using those muscles, and we found a trigger point. But there are some areas of the masseter muscle that actually refer pain right into the teeth where I've had it happen myself where it really truly does not feel like it's coming from the muscle. And so once we can figure out and get a trigger point in the area, I set someone up and just set them up maybe like 5 to 15 minutes, depending on how severe it is. And someone will leave just happy and just like, this is incredible. But again, you have to, home therapy is important. And
Hmm.
I've had a patient who actually, she actually bought a SunPower LED afterwards, just with what we accomplished in the office. She was like, this is amazing. I need to get one for home
Oh,
too.
great. Oh, that's good to hear. Well, thanks for being an advocate for us.
Absolutely.
That's impressive. That's good news. Okay. And uh, how about like post-treatment, post-visit? Does anybody ever come back and say, "Hey, I'd like to continue using this to help with swelling or anything like that?"
So yeah, so actually, what I was going to say, after all treatments, I do follow up with PBM on every patient, and depending on the area and what we're doing. So like for post-surgical, because a lot of my treatment is non-surgical, and I often am using the intraoral device with that. But
Hmm.
if I'm doing a surgery on a patient, I usually end with we're doing at least 5 minutes right on the area, and I have definitely seen a decrease in the amount of post-op swelling and just in general how things are feeling and healing. I remember first getting into it and seeing uh, it almost I remember I think 1 week later, 1 week post-op, and I was like, I can't even see the incision line. This is amazing. And some people do heal better than others, and depending on what they're doing afterwards. I mean, if someone goes home and sleeps on their face after surgery, things are going to swell even if we've done the PBM. So there is a lot
Right.
of that too of how people are treating themselves afterwards. But
Hmm.
consistently, there's just been so much. I would say the healing has been profoundly different, and people healing well.
Speedy recovery time.
Yeah, absolutely.
Amazing. Okay. Anything you feel like we've left out or missed, or anything else that you can think of that you'd like to share?
Um, I'm trying to think, I guess, we can get all scientific on it because, knowing how to use the device for the biphasic and stimulating the healing versus not. So there's nuance to it as well and how we're using it because then some people come in with a lot of pain and we'll just, that's, depending on how I'm using it, if it's longer treatments versus not. Because if someone's just in a lot of pain, you just want to kill pain
Hmm.
and then maybe have them come back to stimulate healing. I think some of the important things, and this is not anything this was interesting. Sometimes someone will come in having nerve injury or sometimes with dental injections, you can basically uh, have it where someone's face, like some of the anesthetic goes into an area where they can have like a temporary Bell's palsy. I had a patient that was brought in with that, and it was just because it ended up getting the facial nerve, so the motor neurons were numbed up. I remember immediately, like someone was brought in, I'm like, just put that palm on there. And I remember her leaving, and because with that, sometimes you have to have people leave. You're putting a cotton ball and tape over their eye because you don't want the eye to dry out. And we did that immediately. I remember we did the palm on her, and it was incredible. Like within an hour, I did a treatment. An hour, she was fine. She was just back to normal. So
Amazing. Excellent. Great. Well, maybe if I could just ask you to give a shameless plug for us. If there's fellow healthcare providers out there, anybody in your industry or any other that maybe there's a little bit of skepticism, maybe similar to the way you might have felt in the
yeah.
beginning, what would you share with them and encourage them with in regards to using PBM or any kind of handheld device that we have or any of our devices?
Absolutely. So in general, And just using PBM. I think that's I think anyone who I've actually done a lecture on this. I tell people really this is such a when I say low risk, it's there's I only see upside with this. There's really not a lot of downside to bringing this into your practice. I mean, if you consider downside that someone might be in your chair for a few more minutes. The upside is this is an LED device, so it's not a laser device. You can have your assistant uh, delivering the treatment for you, you know. So
Mm.
that's an important thing to
Hmm.
because there are different types of devices, different levels. They, you know, they're the laser PBM devices that the doctor is supposed to be the one giving the treatment. So we have an LED device here. The power out of the Sun LED devices is, I think, second to none for what you're getting for the price point. It may not seem like it, consumer level. So sometimes, when we're talking to patients and you tell them how much the device it costs, they're like, oh, well, that's a bit expensive. But when you think about what you're getting
Mm.
for that price point versus, I mean, that you're getting the level of a higher power laser in an LED platform. And the other thing that I really liked was that when you're looking at the spot, this is one of the things that I was showing. Like if you do the spot from the palm, it is it's a very uniform spot that you're getting. You're not getting
Hmm.
hot spots. It's how he created that. He did an excellent job there. That was,
Right.
I've looked at other devices and I see, and you definitely, you're not
It's
getting
like
a,
it's not a leopard print or
not at all.
a
No. So
spot. It's total uniform.
you're getting a very uniform spot. I mean, that's what it's a three, is it a 3 inch spot roughly?
Yep. Yep.
So I don't use this so much as the intraoral device because even though you guys have the adapter, it's
Yep.
it's a little bit less useful in trying to get to certain areas. So some of the devices that are made almost like we're using a curing light in the mouth are more useful for the harder to reach. But as far as getting a spot, because you can do it from externally and get what
Yes.
you need to do. Um,
Tom shows it penetrates right through the
Oh,
gum
absolutely.
inside. Yeah.
Especially when you're doing the 810, you're pretty much getting through the full, mandible and, maxillus from the outside. So that's great. But so again, for the price point of what you're getting, I mean, this is well within reason. You can get I think you can, I don't want to drop other names, but you can spend, 15 to $30,000 for
Yep.
a device that has a spot that, is laser and you know, if you want that. But again, I think the upside is having a device that you can integrate into your workflow where it's
Hmm.
not taking more doctor time if you're worried about your time and workflow and you're delivering the patient just something an excellent it, this is again I don't charge extra for it. You can.
Right.
Some people can. So you can set up and have someone come in. I have a patient who she comes in I want to say every 6 weeks or so if she has a trip out of town. She gets stressed and one of her muscles always tenses up and it feels like a toothache, so she comes in just to
Wow.
to check it out and it feels like bone. Her masseter feels like a bone, so she thinks she has a swelling and I'm like, it's your muscle again. So we set her
Huh.
up in the room for 15 minutes or so and when
Wow.
we have time, we just sneak her in when we know we have a chair for her, and we just do this. Again, we can charge her, and at some point, maybe if I'm doing this more regularly, but for me, that's just like a patient benefit. You've been in the practice, we're working with you. This is something that we will
Yeah. You care
get
about
you
your
feeling better.
patients. You want them to get
Absolutely,
better. Yeah. Good.
absolutely.
That's amazing to hear. Very admirable. Thank you. Um, Well, that's spectacular. Maybe a shameless plug for yourself. If somebody's watching and they could use some dentistry or some work, where would they find you? Are you online? And give us maybe your physical location and
Yeah.
share with
So
us your
again,
practice.
endodontic practice in Diamond Bar, California. So that's eastern edge of Los Angeles County. And my website is Elmi Endo. So it's my last name, ELMI, and Endo, ENDO.com.
Excellent. Well, thank you so much, Dr. Elmi. It's been a privilege and an honor to spend just a few minutes with you. You've given us some incredible value. We've shared your experiences with us, and um, if anybody's curious about red light therapy, they can always reach out to SunPower LED. Talk to Dr. Elmi if you need some dental work done, where we'd be happy to help. We can refer you over to her if you need contact there. So, just thank you for your care for patients and your desire to see medicine be available to to everybody and to help people heal quickly and be comfortable while they're doing it. So yeah, we appreciate you. Thanks for your expertise, and maybe we'll talk to you again down the road.
Yeah, I hope so. This has been great. Thank you so much for having me today.
All right. Thanks, Dr.
Okay,
Elmi.
have a good one. Bye-bye.
All right. Bye.
Well, I hope you enjoyed that as I did. I think that was fantastic by Dr. Elmi, and the interview that Paul did was wonderful. We're going to get into questions in a minute here. I'll just mention again about our different devices. We have the Palm Professional, and that has the 660-810. Next one up is the Palm Ultimate, which has a 660 nanometer wavelength as one of the wavelengths, and then the 810 is the near infrared wavelength. It's 25% more power than the Professional. And then we have the Super Palm, which is the other version up from there, and it has the 660. And then it has the totally invisible 1050 nanometer wavelength. And there's some information that possibly the 1050 can penetrate a little bit deeper. We've seen some things happen a little faster. There's more research going on out there, so we'll learn about it, but it's the cutting edge of not cutting edge, but you're not cutting anything. You're getting treatment into the area very quickly. And some have said that they've been able to see a difference in certain situations faster. So with Dr. Elmi, she mentioned about the oral probe. So there is attachment that can go on to any of the Palm devices. It is this probe that goes in with a special plate. The plate just snaps into the inside here. And once it does, it allows to pick up the light from one of the LEDs and bring it down the tube. So now when I turn this on, you'll see the light coming out of the end of the tube there. And so that allows us to go into the mouth easier. And as you can see, it's going right through my finger here, the optical power as I move that up and down. So that's what the probe does for us, the oral probe. It allows us to direct the light onto the inside of the mouth into some areas that might be more difficult. It's always possible to treat from the outside. So the person just takes this, then just with a little twisting action, takes it off. And now they could treat this way as well. And as she's mentioned, the 810 nanometer has no problem going quite deep as well this way. You can do just a little shorter, faster treatment with this because you have the light right on the area. We also have the helmet. This is our SunPowerLED helmet, and it has the 660 nanometer wavelength, and that just goes on to the head like this. There we go, just down like that, and there would be the treatment going on. And I'll just stay here because I'm enjoying this. It feels so nice and warm, and just a nice warmth. And then a person would do 1 minute of the red and 3 minutes of the near infrared wavelength, which is running right now. It's not very visible, but you can see a little bit of some glowing dots in the picture there. So that is the helmet. It comes complete with the stand and everything that you need to just lower it down on the head. And we've had some really, really good results with people with different cognitive problems, such as strokes and concussions. And as we heard there, that it was Paul Herrington's son that had the concussion that was pretty tough. And he was able to respond very, very well, his son, to the treatment, where from 1 week from being very, very bad to within a week's time being back to normal as a kid. So we've also been able to see Parkinson's improvement, lack of falling. Right after the first treatment, no more falling. And that was a common occurrence, up to 8 times a day, the falling, and one treatment
that was it for the falling. Also been able to, another person was able to draw a clock and put the hands on it and put the numbers, and they weren't able to do that for years. So definitely help for cognitive issues of different kinds. And then we have the, oh, and I'll just mention one more thing about the helmet. We've also seen some dramatic results with autism. The parents are really, really pleased with kids that are very dysregulated, where they may be even self-inflicting injury. They just calm right down by getting a 4-minute treatment, 1 minute of red and 3 minutes of the near infrared. We have a boy visiting our facility here on a regular basis that the parents say, finally, he sleeps really, really well now because of the treatments. And they said, if that was the only thing, we will be coming back here for life as long because he's just to have that good amount of sleep is really important. And not only that, though, they said the day is better too. So they recognize the difference. And we have other autism videos. By the way, please visit our YouTube channel. Before you forget, visit SunPowerLED, search for SunPowerLED or at SunPowerLED. And when you find it, please subscribe. You'll get the latest videos. You'll be alerted to the latest videos. And also, I appreciate anybody who wants to put on their click on the like button as well. If you like certain videos, it increases our exposure through the algorithms that YouTube has. So it's extremely important to us. So if you've benefited from the Palm Lights, you're one of our many customers out there, which we very much appreciate. And I hope that you've seen excellent results in lots of different areas. But I want to encourage you, please do us a favor. Not only can we love to have your prayers, absolutely no doubt about that. Anytime our thought, maybe when you're treating yourself, you can remember about us. If you like to pray for us while you're getting treated, that we might do the right moves going forward, because we got some major, beautiful things that are opening up to us and in different areas, especially when it comes to the cognitive issues and autism and that. But as well, please go to that YouTube channel, subscribe, and like us, or like that video, and go through some of them. There's all the videos that we have are there from going way back. We've got over 100 videos there, and we'd love it if you do that. So we also have the mini canopy, and the mini canopy is a device that's a foot square. We also have a stand for it as well. Okay, and that stand allows it to go up and down. You can, it's not attached to this device right now, but the stand allows you to tilt it this way or that way and put it wherever on the body that you want and roll it up over. If you have one of those massage beds, it works out beautiful. Just roll it right over. Excuse me. It's been a long day. Anyways, this is actually has the two wavelengths. It has the 660 nanometer wavelength, and it has, in this one in particular, we have the 810. Our models, both for the helmet and the mini canopy, you can request to get the 1050 nanometer. It is a premium cost for that, but you can kind of see the 810 coming through there, those little dots. 810 you don't see very well, but I definitely can feel it right now. And it's a high amount of light. As a matter of fact, it has it's equivalent to 15 times the area of the palm unit. So there's that whole area is 15 of these, and about 12 times the power of the palm over the whole area. So it's very power dense as well. And that's one thing if you took one of those very large panels, that you see on Amazon, you'd have to squeeze it right down to about like this before you get close to the power density that we have on our units. So you'd really have to shrink it down. And the reason why we're able to do that, why we're able to get that kind of power density, if I've got special cooling on this that we have patent pending on, and that's why we can cool this device so that the LEDs can have a very long life. You're looking at like 50,000 hours for the LEDs, and it just lowers the intensity. Usually, that, and by when I say lowers the intensity, it's not like the old bulbs that used to drop in half or a quarter of the light output. No, this is like drops in 50,000 hours, it dropped like 10%. So really, it's not going to be that much of a difference on treatment in 25 years if you use it 2,000 hours a year. So easy to use well within clinics because it just keeps going, and you don't have to worry about things to replace. So I'm looking at some questions here. Faith mentions I had the same thing, an oven burn last month, and I used the palm and it never blistered. This is the wild things that how fast this can help with healing. Scott is asking how many months to fix her shoulder with the wand. I think I remember something like 2 months. It could have been longer. I can't remember, but anyways, it relatively quick. But she pointed out something like I've had a frozen shoulder before, and one thing is it's whether it has a tear or not. If you have a tear, you don't want to exasperate the tear. So it's good to find out what it is as far as whether it's a tear or not. But sometimes it's just locked up and it's so much pain you can't lift the arm. But what she said is if you're able to, I learned this from physio, if you're able to put the palm light on the area and then you use your fingertips, like let's say this is the wall here, and you can hardly lift your arms, so you just use your fingertips to walk your way up the wall slowly, and then slowly come back down. You're moving the muscles through a range of motion, and what happens is you can do it again, and it gets a little easier, and you go down the wall, and you do it a few times, and I've had like. I think it's the way I sleep sometimes because I like laying on the one shoulder, and I'll tell you, it is so painful. You can't lift the keys in the ignition. You have to use your other hand to try and poke the keys in the ignition. That kind of stuff. My gosh, does that ever slow a person down? And I've also. I don't know what it is with these bodies. They get old, as they're getting older, they seem to be new problems. I mean, I've had it where I've had that sciatic hip pain, and man, you actually have to lift your leg into the car because it's so painful. And hopefully there's no neighbors around to hear you scream when you do it. But the light therapy helps you to turn that around very quickly. When about 35 years ago, I fell off a ladder on second floor heights. I was way up on the ladder and I pushed the window in. And when I pushed the window in, the ladder slipped out underneath me and I fell straight down onto concrete with the ladder in the way, which probably was a good thing. I bent the rung of the ladder. It actually had a V in it where my shin muscle, the shin bone, and so I bent it. So I probably took some of the fallout on that, bending that aluminum. But I've injured my back, and I didn't break anything, thankfully. But every year, 2 years, I would have all of a sudden this severe back spasms, and that would last months of time. And now when I have one of these occurrences, and I'm trying now more often to use the light more, not that I have pain, but use it when I'm not in pain. And but what happens now is if I have one of those incidents where I have muscle spasm jumps on, the very best thing I can do is immediately start using the light and using it a couple times a day. And using, thankfully I have the mini canopy or the large canopy. So I got my full range of tools to use, but I go under that light and I'm able to treat my whole back or my neck or wherever. I mean, I mean, I don't know what it is, but I have to test out the light on every part of my body. So the other day, I mean, I couldn't move my neck. I was like locked in like this, and it was so painful. Did the light on my neck, and the next day I was able to get this. And now this is like 3 days later, and I almost got my full range of motion back by just using the light on that area. So I have some other questions here. This question is from Maryland. Using the palm for macular degeneration, 1 minute red and 1 minute near infrared with eyes closed. How many times a day do you recommend? I recommend you do a few days to a week, depending on how you feel about things. If you want to take longer, fine. But I would then start off with once a day and then go to twice a day and then even go to 3 times a day. But do that, let's say, a few days, one time a day. After a few days to a week, do 2 times. And then after another few days to a week, do 3 times. Just kind of wrap it up. Make sure you're feeling okay about it, that there's nothing odd that's happening. Although, as Dr. Elmi mentioned, it's an extremely safe treatment. And if you looked at how much energy is reaching the eye, it's kind of like when you don't have signs up on the beaches in Florida or California that said don't sunbathe or you go blind. When you have your eyelids closed, that's the whole thing. Eyelids closed, the light coming in will be diffused in all directions. So it creates a very, very uniform light field in the back of the eye, which is quite safe. And that light field will help stimulate the cells and help with healing and improve wellness for the eye. So next question is, can the intraoral device be used to increase bone graft healing? Yes. As a matter of fact, one of the individuals, this goes back a long time ago. Now, this was a device that was much larger and it wasn't LED based, so it was just a much larger light source. So you couldn't put that inside the mouth, but you could use it from external, just like you can use the palm light. And he had a bone graft done, and he visited the significant bone loss he had, and they had to rebuild a big section of bone in his mouth and bone graft. And they said that the surgeon said, "Wow, I can't believe how good this looks. You've got like 4 weeks of healing in 2 weeks. This is amazing. I don't see this kind of stuff." And my pastor friend said to me that he had told him, he says, "Well, I've been working with this guy with this special light technology that's supposed to speed up healing." That has nothing to do with it. That's just no way. It just you must just be a super fast healer. So it's really hard. People don't want to believe that light can do what it can, but it's major what light can do. It's really interesting. Okay. Can the intraoral device be used I answered that one. That was from Kit. Okay. We have Gladys is asking, is there a booklet giving you the amount of times you need to apply? We give some ideas as to where different parts in the body you might be looking at in a guide, and there is a way to download the manual if you, for some reason, you lost the manual or something like that. You can always go online and go to SunPowerLED /manual, and you'll be able to find it there. please remember again to go to our website and subscribe, to the thing. Also, I mentioned that earlier. I got a few more questions here, but I want to just point this out. We have clinics all over the world. There's a new one that just opened up in Ontario, and it is in Toronto. So anybody looking for trying out the technology in the Toronto area, they could call Merton at the Light Therapy SunPower Clinic at 416-321-7777. You can always call our main office here as well and check things out over here as well. So let's see. Marilyn is asking, you mentioned it's been used for seizures. Can you say what kind of results you've seen? Yeah, so there was seizures. There's now, I guess, a couple people, anyways. They've actually used the light on the area where there's been a problem. If they know that there's a lesion on the brain, it can actually reduce or even eliminate the seizures for quite a long time. You might have to always use it though. And anyways, that's one thing with seizures. And you're looking at 1 minute of the red and 3 minutes of the near infrared on that area. With other cognitive things, where you don't know where the area is, that's where the helmet comes in really handy, because there's 10, it covers the entire skull in one shot. So migraines, a lot of migraines are caused in the back of the neck area with muscle tension. Sometimes that can flare up from muscle tension on the front that starts the migraine. So a person can, on the very first moment that they know they're starting to have the symptoms of migraines, they can use it on the area. Susan is mentioning something that here is going to require me to read. Hello again. Lent my super palm to a friend whose dog was in trouble. 6 years old dog with hind end paralysis. For some reasons, x-rays were inconclusive. Something perhaps with a disc. Vets suggested $13,000 surgery or get a harness with wheels to wear support the back end forever. My friend used the super palm one time a week. I'm not sure. Okay. 1x per week, I guess, along with pain meds and steroids. On Monday morning, 8 days later, the dog was out in the backyard and actually chased the squirrel. Dog is feeling much brighter and getting better every day. They may be up to purchasing one tool. Yes, we've seen this help animals for sure. As a matter of fact, the reverse of, you put that story in reverse, a dog chasing a squirrel on ice, ran across picked up speed on the ice, but was a lab, so kind of forgot that there's momentum and tried to stop and crashed into the far wall of the pond and ended up almost paralyzed. Well, pretty much paralyzed. They had to do the same thing. They had to lift the dog up and down the stairs, lift the whole hindquarters, and they were ready to put the dog down. And somebody had one of my older lights, which is the Genesis Health light, and suggested that they do the treatments on their dog lab. And yeah, they didn't, within, I think it was 2 weeks, the dog was back to normal, chasing squirrels again. You can't give a lab a new brain. They're sometimes they can be smart, but they can be also really dumb. But I've had a lab, that's why I know. Okay, we got a couple more questions here, and we're going to call it close to the end of the thing. And also, if your question does not get answered, please go to info at SunPowerLED and send us the question. Okay. I'll try and speed things along. What is the average irradiance of the 1050 helmet? The average irradiance is about 50 milliwatts per square centimeter. And that's because over the whole skull. And that's because we actually reduced the energy from where we had it at once because it was just too warm. That's a lot of energy on the skull. So 50 milliwatts per square centimeter. And we're finding extremely good results. And that's extremely even across the whole skull. And that's important so there's no hot spots as well. And thank you for, let's see, it's Chuck. Anne is asking, I was diagnosed with a desmoid tumor this year. It is on one of my quads. Is this safe to use on those? Whether it's benign or other cancerous tissue, they have shown that photobiomodulation does not cause cancer cells to proliferate. So it's something that could help reduce those that mass that's there, but it will take some time to get rid of it. But definitely it would help the immune system in the area to do what it needs to do to help with that situation. Okay, Sue is asking, I have friends who are wildlife rehabilitators. Could it help injured animals? Absolutely. A lot of times with animals, you'll have cuts and bruising and all of that kind of stuff. Absolutely can help with speeding up the healing. And anytime you speed up the healing, you actually reduce the chance that an infection will set in. So that's a big one. And also, it does help when it comes to the immune system to even help fight off infection. Okay, what's the area of the body to treat for beneficial for diet? Would it be beneficial for diabetes? We had on last week Dr. Terrence Baker, and he was talking about using the light for diabetic issues and treating the just below the lungs. As I think you'd have to go to your anatomy course and anatomy encyclopedia or go online and try and figure out where the best location, but I believe it's just above just above the navel, below the rib cage in that area. But I'm not a medical doctor. I'm not giving any advice here. You choose to check with your doctor if they know anything about photobiomodulation. Probably 99% of them would not know anything about photobiomodulation, even the whole area of healing wounds and using it for oral mucositis with the breakdown inside the mouth. Yeah, they won't know about it. And then the first thing they'll say, well, that wouldn't do anything. Or next thing they might say, well, I think that might do harm. They don't have a clue. So most of them. So do check with your doctor. Okay, Marilyn's asking, have you seen any benefits to those using it for IBS on their abdomen? Yes. And a reduction in the IBS problems. That IBS, for those who don't know, is irritable bowel syndrome. But it also, I learned something about IBS, and I'm going to pass it along, is I learned a long time ago that I didn't know I had a severe IBS. I would, in the middle of the night, 3 o'clock in the morning, I would be in so much pain. I'd be bent over, excruciating pain. Try to go to the bathroom, nothing happens, all that kind of stuff. And then I heard a broadcast once that the guy said on a health program, He said, if you ever have problems like different problems you can't figure out, write down everything you ate that day, up to 24 hours earlier, at least if you can, and figure out what it was that or do it many times and see what's common. And in my case, it was peanuts. I could eat a whole jar of planter peanuts in a sitting if I wanted to. I loved the things. They didn't love me. And about 5 hours later, they didn't love me. And I was in so much pain. And I thought, well, if I take peanuts out, let's try that. So I thought, I'll take peanuts out of my, and the thing would be is I watch some TV later at night, eat some peanuts. And that's when it would happen early in, sometime early in the, or middle of the night kind of thing. And that was the total problem. I was diagnosed with IBS and they did all sorts of tests and they never recommended I check. Get this, they never recommended that I check what I might be eating. And when I did that, the problem was solved. I just had to stay away from that. Matter of fact, one time I remember my daughter giving me an ice cream cone and she said, "Dad, try this." It tasted really good. And then I realized after I had a few good licks, it was peanut butter. And sure enough, about 4 or 5 hours later, that was bad. Anyways, and early on, when I first figured out that this might be a connection, about 2 months, I didn't eat any peanuts and I was great. Then I saw one of those Reese's peanut butter cups, which I absolutely loved. And so I thought, one peanut butter cup couldn't hurt. Oh, yes, it did. Believe me, it told me, really made it clear to me that I couldn't eat anything with peanuts from there on. And yes, once in a while, a little accident, but other than that, so this is great. We are there's another person. Coffee is asking about, is there any clinics in Ghana or West African countries? Not that I'm aware of. I can't remember which country in Africa there is somebody, but I'm sorry, I don't remember. I think I've come to the rest of the questions here. And that's to answer Yvonne. Yeah, we're going to try and get a list of clinics. Something that we've been wanting to do. It's just been a lot of too much to do and not enough time to do it. So anyways, I thank you for everyone for joining us tonight. I wish you God's richest blessings. And I'd love to have you join us next week, Tuesday. Please remember to tell your friends about us. Also tell your friends to even go to our YouTube channel, SunPowerLED, and tell them to, if you've already done it, tell them to do the subscribe and like. So thank you for everyone who's saying thank you. It's great to be able to see this technology help a lot of people. Thank you. And Peter, Courtney, sorry, I see that you had a raised hand. I didn't see the question. We usually just like the questions put in our email, so the texting. So please email your question, Peter, to info@SunPowerLED. Thank you, everyone. Have a great week. Hopefully we'll see you next week. Bye for now.